It's been known for many, many years, probably over 30 or 40 years, that there is a role of retinoid therapy. So things like Accutane or isotretinoin, etretinate, acitretin, in the treatment not only of acne or psoriasis, but also there is value in treating ichthyosis. The difference obviously is with acne, it's a relatively short course of treatment, so usually 3 to 6 months. Whereas these patients, as defined, have a genetic abnormality. So they have a disease for life. So the issue really comes down to, can you treat a patient safely for a protracted period of time, considering the potential risk benefit of oral retinoid therapies, which are, again, inhibition of bone growth in younger children, could be depression, obviously teratogenicity. The retinoids have a black box warning, have an eye pledge, which requires any woman of childbearing age to actually sign with the knowledge that they can't get pregnant because of the risk of teratogenicity to their child. And so there have been attempts over the years to try to formulate a compound that would include a retinoid, but that could be applied topically and wouldn't really have, hopefully, the same kind of systemic absorption, the same kind of serum levels that you might expect with oral therapies, would therefore not have the same safety profile as oral therapies, and could therefore then be used much longer term. The problem, for example, with isotretinoin is it's extraordinarily difficult to compound. And though I realize on your website, in fact, there are at least 2 articles that talk about the risks of compounding. Compounding isotretinoin is both a very difficult thing to do and is fraught with any of the concerns that you might have around compounding. There aren't that many actual topical retinoids available even here in the United States. There's something called tazarotene. There used to be, which is a different form of retinoid agonist therapy. Isotrex, which is a form of isotretinoin, which is not available here in the United States, but is available in some places in Europe, because it is a very difficult compound to make. We have a unique patented what's called IPEG technology, which is basically a pegylation, which allows better penetration into the skin itself without actually increasing serum concentrations. And so based on that, we entered into a phase 2A program, which completed in 2019, that showed significant improvement, even in a small population of patients. And we just recently completed our phase 2B, looking at patients with much more extensive disease, up to 90% body involvement, compared to what we studied in the phase 2A. And so what we were able to show is, in fact, as expected with topical retinoids, there are the risks of the side effects of topical retinoids, which are predominantly on the skin, so burning, itching, edema, erosions. But those incidences are relatively low and actually improve with time. But we have not seen really any significant systemic adverse events that we could attribute to the drug, which is fantastic. And we feel that we now have a stable compound that actually can be administered up to 12 weeks and has significant efficacy to the patients, which is really all that matters, is that the patients are really actively seeing that their skin is getting better. We just completed the phase 2B. We're very excited about the results. We recently put out a press release with the very high level results. We expect to present all of the results sometime early 2022, which is only a couple of months away. We really will decide whether that's in January or March. We are actively having the manuscript written so that, again, hopefully we will be able to disseminate the data much more quickly. Our hope is to gain fast track designation from the FDA. We plan on meeting with the FDA early in 2022, and we anticipate getting the trial started sometime towards the end of the second quarter. And again, depending on what the FDA requires of us and the trial design that we can come up with, we will certainly try to accelerate trying to get this compound to the ichthyosis world as quickly as we can. A lot of that will depend upon enrollment. A lot of that will depend upon the requirements of the regulatory agencies in terms of their review of the data after we collect it and how rapidly they're willing to bring it to market. So I can't really give you a date. My hope will be sometime, in the next, couple of years. But that's probably as good an estimate as I can come up with.